Person-centred care is about putting the person first before anything else. So it's about considering their uniqueness and individuality in the way that you care for them by asking questions around their interests, their abilities, their background. So for example, if English is their first language.
I know with Mum, she is very happy to be with the carers that she is with, and that's because they both speak Italian.
Some of the things that might come up might be around making decisions about the future and about the person's care. And depending on that person's ability to make their own decisions, they may need somebody to advocate for them. Just because somebody has this disease doesn't mean that they can't participate in making these decisions and having these conversations around their own care.
Dementia and the symptoms of dementia are clearly a medical condition. It's not part of normal aging. So cognition is a very complex group of functions, just as the brain is a very complex organ. And what's typical for dementia is that many of those can be affected and then usually tend to decline with the illness progressing.
It's really important to have some kind of background knowledge about the different conditions in order to be able to provide adequate care for people who are living with these conditions.
It's very challenging diabetes, and it's a big education curve. But not only that, I'm managing someone else's diabetes who has dementia, who's not able to tell me when she's feeling unwell. I have to be able to read it.
Being knowledgeable about dementia and diabetes builds respect and trust between you and the person you're supporting. And by being well informed, you're better able to support people in showing understanding. Language skills and vocabulary diminish as dementia progresses.
People with dementia, they may lose the communication, but they don't lose the feeling. So if you come on at them in a hurried manner, they pick up on that. So, and they will probably become agitated too.
Things that might help when you're communicating with a person could include keeping sentences quite short, maybe allow for some extra time for the person to process the information that you've given them or the question that you've asked them, limiting the information that you do put forward, offering fewer choices, and also remembering that if they don't respond, it doesn't necessarily mean that they're not following what you're talking about or enjoying the actual connection that you're making, which is really the important part of the process.
Finger pricking and the insulin injections are probably the hardest thing. And you can imagine that it's the actual pricking. I mean, they feel something. So if the person doesn't want to do it or it's becoming a struggle, I would just leave it for 5–10 minutes, half an hour if you can push it to half an hour, and then maybe approach it again.
People with dementia and diabetes can be more at risk of depression and anxiety because of the many challenges of living with these conditions. So listen to the person, and if someone reports being depressed or anxious, encourage them to share those concerns and seek professional support and counselling.
We have a counselling service that is available for the person with the diagnosis, for their family members and carers, and we can see people in family groups or individuals as well. This is not easy, it's hard and it's sad, so people in the sessions talk about grief and loss.
At the beginning I put a lot of pressure on myself as far as whether mum should go into care or not. First of all, I had to come to terms with myself. It took me a long time.
Sometimes there's disagreement in families whether there is concern about memory function or not. My recommendation in this situation is to talk to the general practitioner, because older Australians should anyway have an annual checkup of their health. And very often general health conditions like high blood pressure or high lipids or diabetes can interfere with brain function. So having them assessed to support the brain is anyway an important recommendation. If the memory problems or the cognitive problems are mild, the person with diabetes might still be absolutely independent and doing very well to manage their diabetes. However, when the symptoms become worse and progress, there might be some activities of their diabetes management friends and family members have to help with or take over for them.
I would give her a ring in the morning. Mum, have you taken tablets? Yes. Mum, have a look in the container. Are the tablets still there? Yes, they are. Okay, Mum, get a glass, fill the glass of water, let me hear you, drink it.
I help her with dressing. I help her like getting in and out of the car. I help her sometimes with eating.
The local council, we did get help. They used to come in and shower Mum. If we wanted, they could have even cooked for her, but seeing that we were so close by, we decided that we were doing that. She even had people coming in to do the cleaning.
Hypoglycemia has been linked to a higher risk of dementia.
Most people will have symptoms, signs and symptoms that come with hypoglycemia. This can include shaking, trembling, sweating, dizziness, blurred vision, feeling confused, hunger.
People with dementia may not be able to identify when they are having a hypo or may not be able to report this to others.
Sometimes the signs around dementia and a diabetes hypo could be similar. If you think someone is hypoing, don't assume it's the dementia.
A hypo is usually confirmed with a blood glucose meter. If a blood glucose meter is not available and you're not sure, treat it as a hypo anyway. It's much safer to treat a hypo than not to. At the other side of the spectrum is hyperglycemia. Some of the signs and symptoms may be increased thirst, increased urination. You may notice that they're dehydrated, so their tongue may be dry or their skin may be dry. They may have recurring urine infections or thrush, and they might have wounds that won't heal. It might be helpful to keep a diary of someone's blood glucose levels. This way you can pick up trends and patterns of low blood glucose levels or high blood glucose levels.
If someone with diabetes is diagnosed with dementia, their diabetes medicines and target blood glucose levels should be reviewed by a doctor because simplified medicine routines and different blood glucose targets may be appropriate. Adjustments could include trying to simplify the daily regime of administering the medicines, for example, giving them less frequently and choosing medicines which are more long-acting.
They may not be eating as well as they could be or should be. So you might notice, for example, that they're skipping meals or that they've maybe even lost some weight because they're not eating regularly.
I find with Mum, her eating habits have changed. She doesn't like a lot of foods that she used to like. Chewing is an issue. I have to make soft food. I tend to make what I know she's going to eat.
Helpful strategy is to actually leave food around so that they can nibble as they need to, so the food itself just acts as a prompt.
We would buy the food or make the food and put it in the fridge.
They may not recognise that they're actually hungry, or they may have forgotten that they've just eaten. So some gentle reminders could be really helpful in letting them know that it's, you know, time to have a meal.
Mum's taste buds changed and she was actually craving for sweet things, ice cream, chocolates, lollies.
Because of her dementia, she didn't really realise how much sweet things she ate. On a daily basis, she would go to the milk bar a few doors down and she would buy one ice cream, she'd go home, she'd have it, she would go back and have another one, up until 6 ice creams a day. We approached the owner of the milk bar and he said, yes, she does come in here. So we said to him, if she does come, okay, one ice cream, but you are not to give her more than that.
I try and keep busy with Mum. I try and keep her active. I try and keep her socialised with their community, and I try and get her involved. She has a walker, and as she walks around the house, she sings. And I just love it. That to me is just wonderful, to see her happy, walking, and just listening to this Italian music, which she just obviously connects with. And I know that when I test, like 2 hours later when I test, and she's done this exercise, her blood sugar levels are normally, you know, they're good. Lastly, for carers, there is a lot of support out there, and please ask for help if you need it, whether it's for the diabetes or whether it's for the dementia. But, you know, don't let a situation get out of hand when it really can be fixed, or you can be given support or knowledge about how to fix it way before you feel overwhelmed and just not able to cope.